Okay, we're doing chronic right shoulder dislocation. All right. So we're going to go with the example we had earlier where he was throwing ball like this. He got tackled, so he dislocated like this. This position is what I'm going to keep in mind. And for his apprehension test, we're going to say they were negative. So if he's doing this, it's okay for him. I just need to be very careful. All right, so in our treatment here, first thing we're going to do is, of course, start with the superficial techniques. So everything like fascial in areas that might have some swelling. So might have some swelling around the AC joint, around the front of the shoulder, and even some adhesions on the chest and around the bicep as well. So we're going to start with fascial in those areas. So assessing the chest here. Of course, I got consent earlier for the chest. Maybe we found some adhesions here. On this side. Going inferiorly. Pain scale. 2. You can do cross hand here on the chest and the shoulder too, but you need to be careful with how you're applying your pressure. So if I do want to do cross hand, I'm going to do this, and this. But I see a lot of you guys, you just kind of lie on it like this. That's too much. You might just dislocate your shoulder again. So you need to start very lightly just with the pressure of your hands. And then you can start leaning forward to apply pressure slowly with your body, not just going in with your body right away. Okay? That, cross hand here. Pain scale? 2. Your shoulder feel okay here?
Yeah.
Great. 90 seconds up to 5 minutes. And whenever you're moving their shoulder in a dislocation, you want to be very careful and check in with the patient. So when I'm moving your arm like this, just let me know if you feel like you don't want to move anymore, okay? Just let me know, right? So whenever you're doing limb control, you want to check in with the patient. Okay, no swelling anywhere else, or no fascial restrictions anywhere else. So I'm going to start moving on to treating the hypertone area. And could you move to the left side a little bit? Yeah, that's good. And lift your head. I'm gonna use some lotion, okay?
Yep.
And then of course here we're working just on the muscles that are connecting to the shoulder that give more stability or could be injured in the dislocation. So working on the pecs here. Pecs origin from the sternum, costal cartilages, and the clavicle, inserting into the lateral lip here of the bicipital groove. So it's on the humerus. So that's one muscle I really want to work on. Okay, we're gonna move on to some stripping. Might go up to 3 or 4, but if you want to stop, just let me know. Are you okay with that? So again, for stripping, the chest connects to the shoulder. So again, we want to be very careful with our pressure. I'm not just going in right away and pressing the shoulder posteriorly. My direction is more to lateral to medial or medial to lateral and not posteriorly. Pain scale there.
3.
3. Okay. I'm just gonna take your arm and move it around, okay? And just let me know if you want to get out of this position or you feel hesitant or some pain, okay? Because this position is what he got dislocated in. If I want to move his arm like this, again, I need to check in. I'm gonna move it over here. Just relax your arm. And stripping like this. Pain scale?
3.
3. You okay with 3?
Yeah.
Okay, after my stripping of the pecs, flush out a little bit. Okay, again here, I'm doing a little bit of kneading right over his shoulder. Again, I'm not just pushing in and kneading right away. I'm starting a little bit more superficially and working my way deeper in. Okay, and then of course after, you can do other stuff on the pec, like pin and stretch or picking up. Okay, so again, I'm gonna move your arm. Just let me know if you feel too unstable, okay?
Yeah.
Here, pin gently. Let me know when you feel a stretch.
Yeah.
You okay in this position?
Yeah.
Okay. Remember, again, this position is how his shoulder got dislocated. So his shoulder might not be, he might not feel as stable in this one. So you need to check in again. And then I'm just going to pick up your pec here and you're just going to move your arm like that, okay?
Okay.
Just keep it up here for now. And can you cover this side, what you don't want me to touch? Okay. Okay, keep it up here. Okay, and then go down. All the way. Okay, come up again. Okay, go down again. All right, relax. Okay, finish that. Now I'm gonna move on to the shoulder. Again, I'm just going to be treating the hypertone muscles, or the ones that stabilize the shoulder. So I have things like deltoid I can work on. I can work on coracobrachialis. I can work on the bicep. I can work on subscap as well. Okay, and I'll show you one more of the deltoid, just how I would release that again. You're gonna do some stripping on your shoulder. I'm gonna go up to a 3 or 4 again. Are you okay with that?
Yep.
Okay. Pain scale?
2.
2. Okay. So again here, I'm not just pressing into the shoulder. I'm kind of applying enough pressure, so I just slide laterally. I'm not completely pressing down. Gradual pressure until you start to feel like you slide down to strip the deltoids. And then if I'm on this side, like this, pain scale,
2.
2. Okay, after that, obviously I'll flush it out. Okay, and if they were like this, they got tackled from behind, so their shoulder here, it popped out like this, right? It popped out anteriorly. So So chances are there's going to be adhesions, scar tissue on the front side of his shoulder. So that's where I'm going to do frictions. Okay, so we're gonna do frictions on the front of your shoulder here. Might go up to a 3 or a 4. But if you feel too much pain, just let me know and I can stop at any time. Okay.
Yep.
Great. All right. Okay. So this ligament I want to work on, or these adhesions I want to work on, I'm going to say it's going horizontally. So my cross fiber would be vertically. Okay, so that's my direction of my cross fiber. I think some of you guys in your exams as well, you did frictions, but they weren't cross fiber. They were along the fibers. So it's less effective than cross fibers. Okay, so again, cross fiber is going to be vertical here. Okay, start my cycle of my frictions. Yeah.
Do we need to lengthen the first?
The limb.
The limb should be like lengthen position when you're doing cross fiber position.
I think it's only for
You just need a little bit of tension. I think this is enough. Yeah, you could go all the way here if you want, but I don't want to let his arm go like this too much. I'm going to start with this, and then as it gets looser, then I can put it more and more if you want. But this, as long as you feel the adhesions and you know you're on it, it's enough. Okay. Pain scale here.
3.
3. So these adhesions can be from anywhere. Could be on the joint, could be on the muscle. So right now, I would say I'm frictioning the pec tendon. Okay, 30 seconds later, checking in. Can I continue for up to 2 minutes?
Yep.
Okay, great. Two minutes over. Ice, 15 to 30 seconds. And then my stretch. Any stretch here? He says no, so I'm gonna pin it a little bit and stretch. Stretch there.
Yep.
Yeah. Your arm okay in this position?
Yep.
Okay. Okay, 30 seconds later, I'm gonna start my second round of frictions, okay? Okay, again, just for 3 cycles. Then frictions are over, flush it out, and you can move on to your next technique, or further down the arm. So if I move further down the arm, then I'm going to be working on biceps. So again, I can warm up the biceps first, strip biceps, and then flush out. So just do stripping, trigger points, and whatever to decrease hypertonicity there. And then after, one of my indicated techniques for dislocation is isometric and isotonic contractions. So I'm going to choose to do a concentric contraction just to strengthen the muscles here. Okay, so he was like this, so if he's like this, I'm gonna stick with the pec that was overstretched, so I want to strengthen that to keep some stability. So I'm going to move on to concentric contraction. Okay, so from here, I'm going to apply some pressure, and I'm just going to let you win. You're going to go all the way up to here, okay? Okay, go ahead. Okay, and relax. do it again. So this is after you've released or decreased the hypertonicity in all the muscles that you want to work on. And you want to activate it as your very last step, just so they have some stability after your treatment. Okay, good, relax. And then I can just incorporate some joint play as well. So joint play, there's no really specific movement. I'm just kind of moving the joint around like this. Feel okay here?
Yeah.
And of course, again, joint play, you gotta be very careful with this location. I'm not just doing this, like whatever. I gotta be very slow and make sure he's okay.
Can you do a long axis distraction?
You okay? Can you do long axis distraction? You can, but what do you need to make sure first? What about the joint before you do any joint moves?
It was put back.
Of course it's going to be put back, but you're just waiting for it, the ligaments and muscles there to be a little bit more fibrosed. So if you just pull it, it doesn't just come off, right? And even if you're doing distraction, it's okay. But again, you're not just going to yank him right away. You're going to start very gently and slow, right? But yeah, you can do distraction. So I also want to, so I strengthen the pec there. Also want to strengthen the rotator cuff muscles. So I'm going to add in some subscap strengthening. So he's going to, Justin, you're going to go down like this, and you're going to resist me for 5 seconds, okay?
Yep.
Or just resist me, I'm going to let you win. Okay, go ahead.
Okay.
Great, and relax. And again. Okay, and relax. You're going to go this way. So you're going to go in like that, okay? Okay, go ahead. Okay, relax. Again. And relax. And I want him to get comfortable with being in that position, with him using those muscles and using his full shoulder again. So I'm also going to strengthen the infraspinatus. So from down here, you're gonna go up like that, okay? Okay, go ahead. All the way as much as you can. Okay, relax. And again. Okay, good. Any other technique I can use for him for dislocation?
No trigger point, right?
Yeah, you can use trigger point. I didn't show it, but again, I'm not going to show stripping trigger point for everything because you guys already should know how to do that. And I only showed a few muscles, but there's more muscles, of course, like subscap, or you can do infraspinatus from here.
Subscap, how do you do subscap? Like this?
Yeah, so subscap, you'll just get into the subscapular fossa,
Do some.
which you should get into by pulling arm gently, moving over like this. Now he's relaxed his arm and his shoulder blade has come out a little bit. Now I can get in there and press down into the subscapular fossa. And then I can either get him to do some internal rotation with his arm, or I can move it passively for him.
Your finger don't move and
Finger you can move as well,
okay.
but it'll be a little bit
Settle.
more work on your fingers if you're moving it around here. So it's just easier to move him or have him move. But you can definitely move around in there too.
Strengthening of supraspinatus.
Yeah, and then you can strengthen supraspinatus as well. I didn't show that one, but you can do that as well. So from down here to resisting.
Also strengthen the deltoid.
And strengthen deltoid, yeah.
Mid fiber.
Okay. And then of course you would work distally back up to more to proximally. Any other things I can do or would do?
Origin insertion on pecs.
Origin insertion on pecs, like the technique? Yeah, you can do that. So my main things were decrease hypertonicity there, increase the range of motion with some joint play, decrease the adhesions, and strengthen. That's my main stuff. While keeping in mind that he might be apprehensive in this position. So I was checking in a lot as well.
Then hip application.
Sorry?
Hip.
Heat, yeah, you can use heat as well. That's it, I think. Anything else? No, good. Okay, so if this was a patellar dislocation,